everybody, Dr. Ryan here, board certified specialist internist. Thank you so much for joining me, even as we undertake a trip into looking at nutritional status in diarrhea, a head-to-toe clinical approach. Right? If you haven't yet subscribed to my channel, what are you waiting for? Okay, so as always, we're going to just step back and have a look at the patient generally, at the gestalt of the case. Introduce yourself, position the patient, usually semi-foulers, obtain adequate exposure. Then you're going to look at the general characteristics, the weight and the height of the patient. Do they look obviously emaciated? The mental status of the patient, right? And then pick up the hands. You know, us physicians, we love the hands to start off with. Chorinikia usually speaks to iron deficiency. Is there any palmar-crease pallor, which speaks to anemia? Is there clubbing? And that has a whole variety of causes, right? Including cirrhosis and inflammatory bowel disease, right? Then feel the radial pulse, check if it's bounding, right? Because that could indicate high output cardiac failure on the back of thiamine deficiency. Is it irregular, which could imply electrolyte deficiencies, which cause arrhythmias, right? Then assess the skin turgor, and that gives you a crude assessment of hydration. Check for, you check the skin turgor over the masseter and temporalis, over the scapula and over the tibia. Examine the skin while you're at the arms and forearms for eczema, purpura, jaundice, pigmentation, a pellagra-like rash, right, which is B3 deficiency, pellagra. Remember that the rash looks like what they call crazy paving, right? Dermatitis epidemiformis, which usually keeps company with celiac disease and inflammatory bowel disease. Caliper skin fold thickness, just to get a basic idea of the anthropometry, okay? Then Trousseau sign, upper arm muscle circumference as you work your way up. At the eyes, lots of signs to get here, guys. Scleral icterus and pallor, right? Pallor speaks to probably iron deficiency or some form of anemia, could also be B12 deficiency. Bitot spots happens in the setting of xerophthalmia, in the setting of retinol or vitamin A deficiency. Circumcorneal injection speaks to B12 deficiency, optic atrophy. You want to watch for that as well. Looking at the head and neck for any dry hair, any patchy alopecia, any glossitis or cheilitis, which speaks to vitamin deficiencies as well as iron deficiency. Gingivitis could allude to vitamin C deficiency, ascorbic acid. Remember perifollicular hemorrhages in the skin as well. Dental enamel defects, rachitic happens in vitamin D deficiency. Chvostek sign speaks to hypocalcemia. Keeps company with Trousseau sign, the accoucheurs or the obstetric hand. You know those deals right there, guys. Okay, next up, spinal tenderness and kyphosis. Spring, that's. Then the abdomen, check for distension, which could be due to ascites on the back of hypoalbuminemia. Gastrectomy scar on enlarged so-called fatty liver, which we see usually in the setting of diabetes. Perianal fistulae, not always routine, but you can consider that. And then, of course, proximal myopathy. So proximal wasting and weakness speaks to maybe diminished vitamin D because of secondary hypoparathyroidism. Right, antalgic or waddling gait. That patient with proximal weakness will have waddling gait, and check for arthropathy, okay? In the lower limbs, you want to check for edema, for dorsal column sensory loss, which speaks strongly for subacute combined degeneration of the spinal cord. I know the deals right there. We said the mnemonic is two P's in a pod. So one P speaks to peripheral neuropathy, the other P speaks to perineal tract involvement, and the other P, pod, posterior column loss, together with optic atrophy and dementia, right? The Binsky sign happens also in B12 deficiency. Stool examination for parasites, fat globules, oil in the pen. Now this is taken from Tally, and it gives us 17 questions you basically want to ask in the patient who has diarrhea. And whenever you see this exclamation mark, that speaks to serious symptoms. Watch out, okay? So let's cover the serious ones first. Have you ever seen any bright red blood in the stools or mucus or pus? Suggests colonic disease. You want to get the patient an urgent colonoscope. Then, question number 10, have you lost weight? Speaking to cancer or malabsorption. Question number 16, have you had recent fever, rigors, or chills? Speaking to infection or lymphoma. Other questions, diarrhea doesn't really have a specific medical definition, but if the patient complains of stool which is loose inconsistency or increased frequency of passing stool, or if the patient says, listen, I have diarrhea, we're not going to question that, right? Number 3, do you have to run to the bathroom to have a bowel movement? Speaks to urgency in colonic disease. Number 4, have you been woken up from sleep during the night by diarrhea? Anything which wakes a patient up from sleep, anything that's severe enough to wake a patient up from sleep usually means it's organic disease, right? Are you passing large volumes of stool every day, such as small bowel disease, especially if non-bloody? Are your stools pale, greasy, smelly, and difficult to flush away? That alludes to steatorrhea. Have you seen any oil droplets in the stool? Who really looks at their stool for oil droplets? That alludes to chronic pancreatitis. Have you had any problems with leakage of stool? That speaks to fecal incontinence. Have you been treated recently with antibiotics? Consider Clostridium difficile infection. Have you had any recent travel history alluding to traveler's diarrhea? And you implicate things like giardia and your viral causes, norovirus, rotavirus, Norwalk virus, etc. Have you had a personal history of inflammatory bowel disease or prior GI surgery? Any history of celiac disease, which is called gluten-sensitive enteropathy, or inflammatory bowel disease, the two infamous cousins, ulcerative colitis and Crohn's disease? Have you had any problems with arthritis, implying, is this enteropathic arthritis linked to IBD or Whipple's? And have you had any frequent infections, speaking to immunoglobulin deficiency? Okay, my friends, the book of Ezekiel, chapter 36, verses 26 through 27, God says, I will give you a new heart and a new mind. I will take away your stubborn heart of stone and give you an obedient heart. I will put my spirit in you. So the main difference between the old and new covenant is that in the new covenant, we have the Holy Spirit. In the old covenant, they didn't have the Holy Spirit. And the purpose of the Holy Spirit is to make us holy, to conform to the stature and measure of Christ, to be an accurate representation of God the Father on this earth. In so doing, the Holy Spirit helps us to overcome three things: overcome sin, overcome the world system, and overcome the devil. And he also gives us an obedient heart, a heart that longs to do the will of God the Father. And I pray that upon you, even as we pursue the Lord actively. Yeah, my references. Thank you so much for joining me. I'll see you soon with another handy video in the physician examination series. Take care.